All right, so welcome everyone to this week's Our Educational Talk. Today we have a guest speaker. We have Melissa from the Ontario Brain Injury Association, who's going to give us an overview about their programs and their support services. Just a few reminders before we get started to please mute your microphones when you're not speaking. If you do have questions, you can type them in the chat, or if you want to wait till the end, we are going to have a little question and answer period. And thanks to Melissa's permission, the talk is being recorded and will be posted on the Our YouTube channel. A little bit about Melissa. She's a support services worker on the Helpline at the Ontario Brain Injury Association. She is also the stakeholder engagement coordinator for OBIA's Brain Injury Speaks Network. And she's supported people with disabilities for about 10 years now. So thank you so much, Melissa, for joining us.
Thank you so much, and thank you all for joining today to learn more about OBIA's programs. So yeah, it's great to see everyone here today, and I'm just gonna provide some information about our programs, and then if anyone, if anyone has questions at the end, or throughout the presentation, if you need clarification, then you can just let me know, and I will answer your questions. I'd like to begin by acknowledging that the land on which Obaya is situated is the traditional territory of Anishinaabe and Haudenosaunee peoples, many of whom continue to live and work here today. This territory is covered by the Upper Canada Treaties and is within the land protected by the Dish with One Spoon Wampum Agreement. Today, this gathering place is home to many First Nations, Métis, and Inuit peoples, and acknowledging this reminds us that our great standard of living is directly related to the resources and friendship of Indigenous people. We acknowledge that everyone joining us today is from across Ontario, and we ask that you privately reflect on your own areas as you may be on a different territory. At Obaya, our mission is to enhance the lives of Ontarians living with the effects of ABI, acquired brain injury, through education, awareness, and support. Sorry about that. First I'll tell you about our helpline. Our helpline can be reached from Monday to Friday from 4:30 until 4 p.m. And people with living with brain injuries, as well as their family members and caregivers, or any professionals supporting them, can call our helpline for information. You can reach the helpline at the toll-free number 1-800-263 5404. Or you can reach the helpline by emailing support@obaya.on.ca. And so on our helpline, we can assist by listening and providing emotional support for anyone impacted by concussion or brain injury. We can also help by providing information about referrals to resources in your area in Ontario, and by providing information about brain injury. We can also provide advocacy for individuals to access needed services and supports in their community. Individuals can contact our helpline to be connected with other services that Obaya provides as well, or to ask just general inquiries, and we'll always look into how we can further assist. So another free program that we offer is our concussion support group. This support group can be joined online or by phone, and it's a small group of people, and it's facilitated by a social worker, and it provides a safe place to share your frustrations and struggles and learn strategies to manage symptoms following concussion. So the support group runs for 1 hour per week for 8 weeks, and the next session will begin in January. So you can find more information about this on our website or by contacting the helpline. And we can help you get connected with that program if it's something that that you're interested in. So we also have a caregiver support group, which is available to caregivers and family members of people living with a brain injury. And the group is held online as well, or can be joined by phone. And this is a small group that is led by a social worker as well. And it provides the opportunity to share experiences and ideas and to learn how to manage stress. This group is held for 1 hour per week for 6 weeks, and the next session for those begins in January as well. You can find more information about the caregiver support group and register on our website, or again by contacting the helpline, and we can help you get connected to that group as well. We also have a caregiver website. Excuse me, it can be accessed on caregiverinfo.ca. This website has a series of 6 modules and resources to help learn about brain injury. So these include Brain Injury 101, understanding and managing changes after a brain injury, the impact to relationships and family, challenges and strategies for caregivers, information about pediatric brain injury, and recovery, rehabilitation, and advocacy. So again, that website can be accessed at caregiverinfo.ca, and there's a link for that from the Obaya website. So we also have a free peer support program. And this program is available to people living with brain injuries, as well as their family members and caregivers. And through this program, you can be connected with a mentor who is matched based on similar experiences and interests. And usually you would speak on the phone with your mentor once per week. This can also be provided in another format for those who prefer it, so such as speaking over email instead of the phone. And this program is coordinated through local brain injury associations. So the peer support coordinator that's closest to your area of the province would do an intake with you and start the process of matching you with a mentor. You can find more information about this program and how to join, again, on the Obaya website or by contacting the helpline. And we're happy to connect you with that resource. So that's sort of a general overview of our support services at Obaya. So I'd just like to give people the opportunity to ask questions if you have any questions at this time, and if not, then I can share about some other opportunities at Obaya. Were there any questions today?
You guys can unmute yourself or post it in the chat. So it's you.
Thank you.
Hi, it's Pat. Just a question.
Yes.
So, how do like GPs and people like that get awareness of this? Because I'm 4 years in, but it seems like GPs who, maybe don't come across brain injuries all that often, and like if people could get to this type of thing early, right? It could really help significantly, but there seems to be just, I don't know, the GPs, who are the first people you usually go to, don't seem to get this type of information or know where they can get it. I mean, I don't know if there's any connection between how your group connects with, the medical community or anything like that.
Oh, that's such a great point, Pat. Thank you. Yeah, so we do find that there can be a pretty big gap in that area across Ontario for sure, in terms of GPs, family doctors, not being aware of resources like Obaya or other resources for people living with brain injury. So that is definitely something that's on our radar and that we're working to address in various ways. So we are on several, Obaya is on several committees across the province that provides input on healthcare related to brain injury and that sort of thing. So that is definitely something that we are advocating for more of. It's not something that is mandated at this time in terms of having GPs be required to have or share this information, but that is definitely a direction that we're looking to kind of move toward, just getting that information out there through about Obaya's resources or similar resources, so that people can find it sooner. And I will share a bit about more about Obaya and the ways that we're working on those types of issues in the following section. So hopefully that gives clarity, but that is a really good point, and something that I'll make note of to share with the team, just about accessing the information, because certainly that is a big issue following brain injury that that primary care providers aren't aware of or aren't accessing that information. So so that's part of why we do presentations like this, to try and spread the word about it. But there are various ways that that we're trying to go about having that information shared.
Okay, thanks very much. That's great.
Thank you. Were there any other questions?
I don't see anything in the chat either, so I think we might be okay for now.
Okay, perfect. So I'm just gonna continue on and share a bit more about some other things that Obaya are doing. So this is a bit outside of our support services, but kind of ties into what Pat was just mentioning. Sorry about my slides here. So we do have a network called Brain Injury Speaks, which is a stakeholder engagement network. So this network is designed for people with lived experience of brain injury or their family members. So the idea of the network is to come together across the province to create one provincial voice to inform and respond to issues about brain injury. So through joining this network, which you can do through the Obaya website, you would have the opportunity to voice your opinion about issues related to brain injury. And the issue that Pat just raised is a perfect example of that. So so that is an opportunity that I'd like everyone to be aware of, and to pass that information along to anyone who might be interested. So this network is a growing community. Right now it's around, it includes around 500 people who are impacted by brain injury. And it's really about providing people who are directly impacted by brain injury with a seat at the table, and viewing brain injury care in Ontario through the eyes of the individuals who are living with it. So part of this just involves improving healthcare and really actively listening to individuals with lived experience in order to advocate for policy changes and improving quality, safety, and outcomes in brain injury care. So as I said, you can join the network through our website, and then we engage the network through a variety of avenues, but it really is focused on highlighting the issues that people communicate through the network as being the most pressing issues in brain injury care right now. So part of how we do this is through patient engagement projects. And these projects are, again, the topics for them are stem from what people are voicing to be the most pressing issues. And then we develop projects to engage with the network. So either through surveys or focus groups. And then we create a report based on what we find. And then we use those reports to, again, on the committees and the various avenues that OBIA is connected with through the ministries in the province to advocate for change in brain injury care. So we also, Brain Injury Speaks, we create a monthly newsletter that that is focused on sort of practical applications that and the topics are shared. The topics we base that on are again topics that the Brain Injury Speaks community has voiced to be the most important that they want to hear about and discuss. And then we also send out emails from of relevant surveys that and studies, that other organizations might be doing that they want us to share with the brain injury community, or that we think is relevant to the brain injury community. So we'll send that out as well to the Brain Injury Speaks network. And we also encourage people to just email or call us about specific issues that and ideas that they have. So yeah, as I mentioned, this network is available to anyone who wants to join who's impacted by brain injury, and we would love to hear people's feedback and input about the direction of brain injury care in Ontario, and we're always working to make those voices heard through the network. So another opportunity that we have through OBIA is the Brain Injury Impact Study. So this research study brings awareness about the needs and long-term outcomes of those living with a brain injury and concussion and their family members. And the purpose of this is to better inform those who are looking at ways in which people living with brain injury can better be served. So the questionnaire is available in paper format and online. And there's one version that is tailored toward people living with brain injury or concussions, and another that is available to family members and caregivers. So when you complete this study, you can receive a free membership to Obaya and a membership to a participating local association. So there's a list of affiliated brain injury associations that you can receive a membership to as well. And those studies are, we do have follow-up studies that are completed annually to see the way that brain injury are impacting people over longer periods of time. So as I mentioned, through the impact study there, you can receive an Obaya membership. And the membership allows you to join our community and be kept up to date with acquired brain injury news and activities. The membership includes a brain injury survivor ID card, a subscription to the Obaya Review magazine, which is available online and can also be provided in hard copy. It also includes a special acknowledgement, a discount to Obaya training programs, participation in the peer support program, and you're also entitled to vote at the annual general meeting for Obaya. So those are some of the membership benefits. But as I mentioned, the support services earlier, you don't need to be an Obaya member in order to access those services or to call the helpline. That is available to anyone, regardless of whether you're a member. So if you'd like to connect with Obaya, you can connect with us on Facebook. We're also on Twitter and LinkedIn, and you can find our YouTube channel, and you can find us on Instagram by searching, and you can search the Ontario Brain Injury Association on any of those platforms, and you can connect with us that way. So that's all the information I have today. Does anyone have any questions or comments?
Again, you guys feel free to unmute yourselves and ask the question or put it in the chat.
Hi, Melissa, it's Pat again. So I was just going to say this is great because I think for me personally, I, belong to the Brain Injury Association York Region, and we have a support group and it's all great, but it's great to have a vehicle to get your opinions to somebody else who may make a difference, like in that program or the research study, or, something bigger than just, York Region, right? So I think for me, I'm absolutely going to do it. I think it's just really important to be able to spread that around, because I just don't feel it's out there enough, this whole topic, right? So it's really great you've created these vehicles. So I'm really happy to see them. So that's great. Thank you very much for informing us. It's great.
Absolutely. Thank you so much, Pat. Yeah, we would love to have you get involved for sure. And yeah, like you said, it just in terms of getting connected outside of your immediate community, there's a whole community across Ontario of people living with brain injuries who are impacted by a lot of the same issues. So yeah, we would love for more people to join and to share your perspectives. And yeah, that's great. Thank you so much. there any other questions or comments? Okay, well, I really do appreciate each of you joining us today, and for learning more about Obaya's services. Please feel free to reach out, and if you have any questions over the coming days, I'd be happy to answer them. I can be reached on the helpline, which is the number I provided. So I'm the primary person who answers the helpline, and then there's some other staff who can also assist. So I would be happy to chat with any of you if you have any questions or ideas, or need any more information or clarity. Then please do reach out.